The next module is what should a healthcare worker know about this topic? Maybe I mean by that a non-physician healthcare worker who is supplementing and often providing the only available care. And that is, they should be able to initially evaluate diarrhea by assessing the onset of the diarrhea, frequency, amount of diarrhea, and whether there's also vomiting with the diarrhea. Ask the patient if they've been in contact with anyone with similar symptoms, whether they have taken antibiotics or have any other known medical conditions, such as HIV or diabetes. Ask about recent oral intake, including unpasteurized or undercooked foods. It's important to look for symptoms of infant dehydration. That is, the fontanelle or soft spot on top of their head, if it's sunk down, that indicates that the infant is very dehydrated. A high fever, if an unstoppable thirst, if there is sometimes decreased urination or no wet diapers because all the body's fluid from the baby is passing into the stool. If the baby is sluggish or fatigued, has dry eyes, they are crying but have no tears. If their mouth is dry, if the skin doesn't spring back when pinched up. Some mechanisms of diarrhea, this is caused by bacteria or parasites in food and water coming down the esophagus into the stomach. Most that come into the stomach will have been destroyed by gastric acid, and there is acid in the stomach to destroy bacteria and not specifically for digestion. In the diarrhea situation, normally water that passes from the body into the intestine to help digest the food, but and that fluid is then recycled and pulled back out of the colon or the large intestine and recycled and reused by the body. With diarrhea, the fluid, even the normal amount of fluid in the intestine, can't be resorbed and passes out as diarrhea rather than being recycled and reused by the body. Some of the danger signs in diarrhea: fever and dehydration, stool with blood or pus, severe pain, low blood pressure from loss of fluid, and it's also diarrhea can be more of a concern in patients with HIV, patients who are taking steroids, those who are malnourished, those are very old or very young patients, or those who have recently received antibiotics or been in a hospital, because hospitals can in a way be dangerous places that a patient in a hospital for one condition may acquire dangerous bacteria from another patient, or diarrhea that persists for more than a week. So the usual approach, a patient with acute diarrhea, most have an early mild course, no blood in the stool. They can just be observed, encouraged to drink fluids. If available, they can be stool culture or examination, and if specific dangerous organisms are found, they can be treated or not. Those that are patients with acute diarrhea that develop bloody diarrhea or who are immunosuppressed, then it's more important where possible to get stool culture or to examine for ova and parasites that can be treated. And the treatment, in most cases, diarrhea resolves themselves when hydration is maintained and tests are not usually required. It's important to keep track of the vital signs. If the pulse is going fast and the blood pressure is low, that suggests dehydration and requires more enthusiastic encouragement of the patient to drink fluids to replace lost body fluid. And it's important to watch for warning signs like high fever, severe abdominal pain, bloody or mucousy stools, which may require more specific treatment.